There are ones who are with you most when you're sick. They are the ones who are with you most when you are sick, the nurses. And right now, many of them are scared and they're concerned about not having proper protective gear. What's more, many of them are also scared to speak out about their concerns. They are on the front lines of the crisis. Nurses who are so often hands-on with patients positive for COVID-19. But for weeks now, some of them have felt unprepared by their employers to handle the surge of patients that are passing through New Orleans area hospitals in waves. I've spoken with several nurses and staffers working in major New Orleans hospitals, all too fearful of losing their jobs or their licenses to be identified. They say infection control has been lacking, especially because of the shortage of personal protective equipment, or PPE. One person tells me they witnessed a manager, quote, discouraging staff from wearing PPE since we've all probably had COVID anyway. Thea Ducro is executive director of the Louisiana Nurses Association.
I started getting confidential phone calls around 3 weeks ago, and the nurses are concerned that they do not have enough PPE, and they're expected to care for patients that are contagious.
She recently surveyed more than 700 nurses statewide about their concerns. At the top of the list, the lack of PPE.
They're worried if they're going to contract it. Several of them have also mentioned that they're worried about the other patients. Let's say if they're serving in an emergency department and they have someone that presents with a broken arm, they don't want the person with the broken arm to go home with the coronavirus disease.
And some nurses say they're wearing the same protective masks to treat both, reusing masks at times. Many report getting just 1 or 2 masks per day, sometimes the kind that filter out viruses, other times a surgical mask that doesn't. Is that happening?
Yes, the nurses are telling me that. And the nurses are telling me that some of them, they don't even get an N95 for their shift. They're getting surgical masks. And so while that's better than nothing, it is not ideal.
Other times they're getting N95 masks that don't fit properly and can allow germs in. All of it is taking its toll. Are they getting sick?
Yes, some of them are getting sick. They're worried about getting sick.
We don't know in what numbers. The good news is truckloads of donations of PPE, public and private, are helping to ease the nurses' concerns, alongside an expected surge of patients in the coming days. Most of the nurses told the association most felt their employers were doing everything that they can to get more PPE, that they know that the CDC puts special guidelines in place for PPE during this crisis to conserve those masks and gowns. Many also wish more hospitals had decontamination units. Many of the nurses are undressing in their garages and carports to run straight into the shower when they get home to avoid infecting their family.